think it might be good to have somebody come
He's going to try and come today.
today. Oh, okay, good.
Okay, I'd like to call to order the Budget and Finance Committee workshop. I'd like to change things around a little bit. We would like to see social services first. Okay?
Thank you, Karen. Starting off with a good note.
Especially since you stayed since last night.
Oh, yeah, that's right. I'm glad you noticed. Do I look like I slept my I want to introduce my staff here, senior staff. I got Johanna Del Costello, who's our eligibility director, who's also running our operation in Amsterdam now. And then Robin Weaver, director of services, and Tina Sweet. We've got all the detail for the discussion this evening. So I think some of you know these folks, but this is our fourth budget. Tina and I have done together. Just to open up, I may have said this before, looking at forecasting and doing a social services budget it's one part science, it's one part art, but it's one part black magic really, because you really don't know what's coming at us. We can do all the forecasting and look at trends and all that stuff. And I'd like to just give you what I think are some of the assumptions that we used that guided us in this budget. One is your unemployment rate in Montgomery County is still, it's not good at 7%. That's the official, but we think the unofficial number is probably much higher. And that's guiding some of the issues we're seeing. Our family assistance cases, safety net cases, of course, which is hard to find, get people off the rolls, affects our child care numbers. So that's still slow. So we have a slow economy. We all know that. It's really nothing in sight that's going to change that quickly. Our foster care caseload is up, and it's almost doubled since 2013. Some of that is due to the economy. Some of it's directly related to the opioid use. That's an epidemic throughout the Northeast. And the other thing is that we're seeing when we remove children from homes, we're seeing larger families. In some cases, we're moving 5, 6 kids, and that's changing our numbers. I don't know if you can really forecast how many, but we've done several families that are large. They go in foster care and they stay there for a while. Rising homelessness is also something that's happening. It's something that's being talked about across the state. We saw 80 people last year in a homeless shelter. We expect the same this year, unfortunately. Conversely, back in 2011, we had maybe 11 people that went to shelter. Saw 80 last year, including kids that we enrolled in school. And we moved most of those folks to temporary housing or permanent housing. So that's a big job. We just had a meeting tonight, or this afternoon. We'll be opening November 16th. So we expect the same thing as last year. Some of the realities, though, for this budget, there are assumptions that I just told you about. Some of the realities are is you have Medicaid redesign. We're in the 5th year of redesigning Medicaid across the state. Some things have been taken away from counties, certain populations of Medicaid cases, recertifications and those sort of things. I'm not going to get too much into detail. But by 2018, the state has to fully assume the administration of Medicaid. That's a big change for counties because we've had Medicaid in the county. We've done the work since 1964. Barbie, you weren't even born yet, right? I'm helping you.
Thank God.
But really, it's a big change. The other thing about Medicaid is that we will lose, once our administrative money starts to dwindle, that'll probably start happening as early as 2017, not that far out. We are going to have to make some tough decisions. We'll try to reduce staff through attrition, and through retirements, and that way, that's the way we'd like to do it. But that will happen. As the work slips to the state, we're going to do less. We're going to get less administrative money. You heard the Bonadilla group, particularly Tim Bullock, talk last night on chronic care. I think the counties will hold on to chronic care because it's such a tough caseload. You heard how complex it is. I think we will hold on to that. I think the state's going to agree to that. So we'll want to, at some point, move probably more workers towards that. Disability cases and things like that take a lot of time. The problem is we have a lot of employees. If you read through the narrative, you see that a lot of employees are at retirement age or very close to it. Not only retirement age, but they put their 30 years in very close to it. But that's something for succession planning we have to really look at in coming years. Our DSS Amsterdam is going very well. We're partnering with the OFA, we're partnering with Workforce Solutions, and so that's been a very good project. I just wanted to give you an update on that because that has a budget impact in the positive, I think, in the long run.
Very busy project.
Very. Yeah. We're going to study it this year, but really I can report that it's going very well. Unfunded mandates are really killing us. So one of the things, I think Robin might tell you more about it. Caseworkers, particularly in our services, are being asked to document much, much more, particularly in cases, things that we haven't really dealt with before, like human trafficking. But there's a lot of requirements being put on caseworkers, and that's going to increase our need. At the same time, the turnover of caseworkers is at an all-time high. That's in my narrative too. We hired 9 this year, and we are right now knocking on wood that we have a full staff in services. But I don't think that's going to last long. You know, there's a lot of stress on that population of those workers, and so that's something we have to keep in mind. We've got to bring more through the door. We have to recruit more, bring more through the door to keep that caseworker group together and fully functioning. Our legal needs are increasing drastically, and that's why I'm asking for a full-time attorney. Our attorneys right now are 2 part-timers do fantastic work, but they are fully deployed doing what they're doing. I really need a full-time attorney for several reasons. Last year, in this year's budget, we added a resource recovery person who was going after financial people that owe us money, and she's doing a fantastic job. She is doing such a fantastic job that the attorney is now, we need more attorney because she's generating a lot of petitions, a lot of agreements, and this is driving up our need for a full-time attorney. That's just one thing. You heard Tim Ball talk last night about the Title 4E, the foster care money. This is money that we can get for our foster care cases. It's very complex in that it takes us working directly with the court. The language in the petitions, the language in the court proceedings, language after court has to be exactly right before the federal government will release funds to the county. And when we don't do it right, we don't get that money. That's reimbursement. You heard the number you gave me last night, $480,000. That's something we, especially with the cases going up, we're going to really assume that every foster care case that comes to us, we're going to assume right off the bat that it is 4E eligible. And that's the way we will proceed. However, it's really going to be helpful to have a full-time attorney to look over that caseworker's documents, follow it to court, make sure that court piece is done. And that's why we've had such a hard time with them. And we've reorganized that department, and I think he said it last night, but I'll say it again, because we had an eligibility worker, so a social welfare examiner was doing the work. But what we really needed was a caseworker who understands services, understands the court piece, understands what's going on in these families, and understands foster care from a more detailed perspective. So we've made that change already, but now we need the attorney. The other thing is we've had a dramatic increase in FOILs, in requests for FOILs, and I think a lot of this has to do with the opening of the Empire Justice Center last year or 2 years ago, because they're catching up, so they're foiling us a lot. And it's in every different department, in every different program area, but really it's good to have an attorney look at those before we respond and make sure we're not causing another problem down the road, if you will. Complex guardianships are also on the rise, I think. We've done several. Some of these guardianships the commissioner is the guardian of the person or the persons, and many times they have multiple properties. They have houses, they have cars, and I have to deal with those, and it's very difficult. A lot of back and forth at the court. Sometimes there are not amiable relationships, and there's a lot of other attorneys and people get involved with those. So I really also need help in that area. And then policy review is my last thing that I really need an attorney for, because we get asked to weigh in on things that the state's proposing. And it's really good to have an attorney look at those policies, because sometimes they have an unfunded mandates in there. And it might be a legal requirement, it may be a work requirement. And with those things, I really don't have the time to devote to, but I really would like to. is at least weigh in from Montgomery County that we see an issue here. Other counties do it, but I would like to at least, add our voices to those, to prevent some of these things that they get stuck with. Any questions for me?
Joe?
Thank you. Excellent presentation. I've gone over some of this stuff with you before, just briefly, and I appreciate the narrative. I support these changes. I think you really convey a good grasp of what is trending and why these changes are needed, and that's why I want to support them. It's hard for me to understand a little bit of the narrative versus the way the actual budget is set up. Does the executive budget reflect these changes that you requested?
I believe so. The current one that we got, I think, just today, does reflect.
Okay. So if there are any gaps there, you should let me know.
There is.
Okay. Thank you.
Okay. Martin?
Last year, we set aside some money for a homeless shelter at Daniel's house. Is that?
That's still in there.
You mentioned you partner with LFA, and I know you do with Community Action Vermont. Those partnerships, are they reimbursable or partially reimbursable, or
Well, let's see.
for their services?
For example, Wheels to Work is a program that we work through with Beaumont. We basically give them the money, it's pass-through money. So they basically, are putting clients into vehicles so they can go to work. That's one program we work with Beaumont with. The other one is they're a heat vendor, one of our heat vendors. They get paid per heat application. So every application they do, they get $20. They get $18. That's a big revenue generator for them.
And that's federal and
That's
state?
federal money.
That's all federal money, yeah. And the OFA is also, just to let you know, the OFA is also a heat vendor for us, and they work with population 55 and above.
Do you do any other partnerships with OFA?
New York Connects, which is a program designed to keep folks in their homes as they get to an age. New York Connects is very popular. That's what we were actually partnering with them in Amsterdam. They're going to have a desk there, working with that, long-term care program.
And that's state funded, federal funded,
I think it's a mixed bag. I think it's a state fit.
and very low local, or no local?
No.
or-
There's
No.
no.
There's
There's
no.
no.
They actually got a grant. That's part of the deal. They got a grant this year that's going to allow them to open a facility not only in Amsterdam with us, but also in the Canada area.
The new attorney that's budgeted and stuff, are those salaries, what's the ratio for reimbursement for those?
An administrative salary is 55 federal and 21 state. The rest is 24 is local.
Oh, Barbara.
Thank you. Last night, one of the things that we heard from data was there were certain lines that could be in other budgets. Understanding though that there are items that are specific for those departments. Could there be lines that could be worked with in this 2220 or is everything in here?
The reason office equipment or computer equipment is in my budget is so I can get the federal funding. We need to pay them out of our budget so I can get reimbursement through the government.
Okay, I knew there would be a reason.
Yeah, that's why it's in my budget, so I pay for it and I claim it.
Okay.
That's why we have an IT person here. Barbara,
Yes.
I know.
that we brought over so we could, relieve the county of that local share. We picked it.
And that's one of the persons that does work with Dan, that he's in coordination with all of it.
So,
Excellent, thank you.
From last year to this year, your department took over the mail room. And
Yeah, it's worked well. we have backup. You know, well, with Amsterdam, that changed it a little bit, but really, even since we've been on 4 months, it's worked very well. I think some of the Medicaid traffic down the road would probably decrease the amount now. That's yet to be seen, but I think it will.
And then in your revenue, prepayment of medical assistance, I see that zeroed out. There was a decent amount of revenue in there previously.
Address that, what happened out here, I think it's that one.
Was that a program that ceased?
Well, no, Medicaid, the state takes it back. We collect the claims and then the state takes it back. So we had a negative number in there and our auditors didn't like those negative numbers. The offsetting, it was 1801. That's where it comes in, and then the state and federal take it out of 3610 and 3601 and 4601. So there was negative, it was just all offset, so the auditors wanted it all out of there. So they're all zero because it's all state and federal money because we pay our cap, and any reimbursements we get, they just take back anyway. Understand?
So the realized what we have this year is 152,000. That just isn't an in and out. We're collecting
Yes,
it.
yeah, the federal government will take that back.
Okay.
I see the motor vehicle equipment line increased quite a bit, 2230. Are you on a schedule now with replacing vans? Or?
We're going to retire 2 vans next year. They're at 130 and 140,000 miles, and they're starting to nickel and dime us at DPW. So yeah, I have 2 vans in there to replace for next year.
Okay.
And those are partially subsidized?
Yes, those are also administrative costs, which are the same reimbursements as before.
Anyone else? Okay, we're good,
Yep.
or is there anything else you want to talk about? No?
I could talk all night long.
Yeah, you probably could. You probably could.
That's one thing, that doesn't have to deal with the budget though, but it could in the future, and we've talked about it. But as you're working with the state, could we continue to try to fight for CASA to somehow be incorporated into our budget?
I think the way to approach that is with the Office of the Courts. You know, because I would tell you that the social services in New York State and CASA have had a very rocky relationship. That's because of cases that did not originate here. I was a CASA guardian ad litem for many years. I do believe that it's helpful. But I think there has to be a redesign on how they do their program. So I would be open to it. And I think other commissioners may be, but I really think that conversation has to start in the Office of the Courts.
Actually, one more thing. I wanted to, because we have the person here who's worked so hard on opening new locations in Amsterdam. How do you feel that's been, as the transition been, now that it's had a little bit of time to be there?
I don't want to jinx myself. I mean, they've been very good, and I think Johanna will probably say the employees are very happy. They really like their new space. We're seeing, what we've noticed here, you don't see the amount of folks staying here all day because they're waiting for a bus. We're going to see a reduction in security here. We will not need 2 deputies here. You know, there's a lot of things that are happening here. We have more space. We're not sitting on copy boxes or each other's laps. We were pretty tight, 30 employees leaving this location. It's gone very well. Our landlords, Riverfront Center, have been very good to us. Any maintenance issues they've addressed. So I can't say enough about it. I can't really tell you anything.
It's been really busy down there, and your people have been very nice to everybody, so I just want to know that.
That's excellent. Thank you. Thank you. Okay.
Very good. Thank you, Commissioner. And I guess that's it. Thank you.
Thank you. We'll go back to work.
Yes.
That's what I came to say.
Nice job.
Bye-bye. Thanks again.
Thank you.